Dr. Rashid Al-Sawadi, my dear friend Sione, Your Excellencies, colleagues and friends, in times of so many crises in the world, we need to remember that the health of a population is a barometer for the well-being of a society. In WHO, and as you've just heard from Dr. Tedros, we are therefore calling for a radical shift towards health promotion and well-being. And this requires that we need to reach out to other sectors and ask them to rethink their strategies and goals. As if health is created, as we all well know, by and large, outside of the healthcare sector. The WHO Geneva Charter for Wellbeing describes the foundations for all generations to thrive on a healthy planet, no matter where they live. For instance, economic strategies should serve social and environmental goals and not the other way around. Such societies apply bold policies to transform societies that take better care of our planet, apply innovative governance models, achieve universal health coverage, and use digital innovation while identifying potential health risks. In the past decades, the global health promotion community has gathered literally hundreds of excellent examples how the settings of our everyday life, where people live, grow, learn, work, and age, can be made healthier. The health promotion community has also developed practical pathways for well-being societies and highly effective instruments for better governance. So, it is neither a question of what, nor a question of how things can be transformed to make the world a healthier place. As Dr. Tedros also just said, well-being is a political choice. It is the outcome of policies, institutions, economies, and ecosystems in which people live. For the meeting ahead of us, I have 3 requests to you. As the global health promotion community, let us assess how we are working with others to enable people to take control over their lives and lead fulfilling lives with a sense of meaning and belonging in harmony with nature. Through education, culturally relevant health literacy, meaningful empowerment, and engagement. Let us discuss how we can even better enable, mediate, and advocate for a unifying approach to creating well-being societies by shaping the determinants of health in all settings. I'm sure that you will use this conference, held in the Middle East for the first time, to discuss new evidence, experiences, and challenges, how to adapt and rapidly changing environments in countries around the globe. And I am so grateful to UAE and to IUHPE to go this path along with us since its beginning, when we started to develop the Geneva Charter for Wellbeing. When discussing the way forward for health promotion, let us do this in light of the tectonic shifts happening within and between societies that we all witnessed in the past 5 years. The COVID-19 pandemic exposed deep vulnerabilities in public health systems and caused immense suffering and taking nearly 20 million lives. The pandemic triggered a major global economic crisis, leading to widespread job losses and disruptions to global supply chains. Recovery has been slow and uneven, especially in developing countries that have had limited resources to support vaccination and economic recovery. We saw a second epidemic on top of this pandemic, the social disruption fueled by mis- and disinformation in the internet as people no longer trusted policies and public institutions. Just as the world began to stabilize, the war in Ukraine since 2022 intensified economic hardship, driving food and energy prices to record highs and exacerbating a global cost of living crisis. Inflation surged to a 2-decade high, prompting central banks worldwide to tighten monetary policy, adding further economic pressure to households and businesses. The latest political disruptions of global health by the United States of America exacerbates the situation, especially as they come without a grace time. These events make it clear that we are facing more than isolated setbacks. We are living through a poly-crisis where climate change, environmental degradation, widening inequalities, and political instability compound one another, undermining the very foundations of societal well-being. Our current approaches to health, the environment, and the economy are proving inadequate in the face of these interconnected threats. Addressing them in isolation is no longer viable. The good news is that there is a way forward. The Sustainable Development Goals provide a comprehensive framework addressing these crises holistically. But making real progress requires more than just commitment. It demands new forms of moral responsibility and leadership, collaboration and empowerment. We need to reform siloed systems and institutions, foster innovation, and ensure that knowledge and resources are shared equitably. This requires individuals and communities to think in truly integrated and creative ways, embracing local and indigenous wisdom and lived experiences as essential tools for change. Ignoring this imperative is not an option. To achieve this, we must prioritize a transformative vision. The creation of well-being societies, environments where people can reach out to their full potential, live healthy and fulfilling lives in harmony with nature, and actively contribute to their communities. These societies must be built on key principles, recognizing that well-being goes beyond the absence of disease and encompasses physical, mental, and social well-being. Understanding that well-being depends on a complex interplay of social, economic, and environmental conditions. And embracing a whole of government and whole of society approach to decision making that looks beyond narrow economic metrics. In health promotion, we have developed a comprehensive approach for creating well-being societies. It offers clear strategic directions, practical guidance, and a call to action for all stakeholders. Colleagues, this is not just a theoretical exercise or academic discussion. It is an urgent and practical response to the crisis we face. The time for incremental change and projectitis has passed. We need bold, decisive action. We must shift our focus from simply treating illness to actively promoting well-being in every aspect of society. I urge you to engage and join us in this critical work. Together, we can build a healthier, more equitable and sustainable future for all. The role of health promotion can play the role that health promotion can play in global health has long been undervalued. We now need your experience and voice more than ever. I thank you.